We revisit our series on women's health issues with a look at 5 medical tests all women should get. Smart Medicine spoke with Dr. Susan Merman about those 5 tests. Here's what she had to say.
The first thing you want to look at is any type of breast imaging. That comes in the form of a mammogram usually. We start a screening mammogram anytime between the age of 35 and 40. It's usually yearly after the age of 40. Now, if you have a family history or a significant problem, and consult your physician, but we would be doing the mammogram a lot earlier, sometimes as early as 30, especially in women that have had their mother or their aunt have breast cancer, and that might implicate a genetic component. The next screening we'd also recommend for females, especially starting at an early age, at the age of 18, is an annual exam with a pap smear. And it's very important to start this exam early because now we're realizing that a large majority of the cervical cancers are sexually transmitted through a virus. The third test we want to talk about is the bone density test. This is very important when a woman reaches the menopausal age because as her hormones begin to decline, the incidence of fractures and thinner bones increases. The fourth test I'd like to talk about is a cholesterol profile and a thyroid exam. They are very, very important, especially when women are getting over the age of 40 and they might have a tendency to have high cholesterol either through their family history or they may be a little overweight. If they're overweight, they smoke, they have diabetes, they might want to consider getting treatment for that. Now, women younger this can usually start screening around 30, especially if they've already presented with those risk factors I just mentioned. Last but certainly not least is colon cancer screening, and this is very important for women starting at the age of 50. They should have this test performed usually in the form of a colonoscopy. However, if you are at risk, have a family history that's positive for colon cancer, you need to have this test done a lot earlier.